I think the good news is that they're very effective, and I need to say that again and again. uh, and I'll be happy to say that because these are 95% effective. Moderna, Pfizer vaccine, the technology is very, same, 19-20 difference. So there are two, mRNA vaccines that have shown 95% efficacy. So they are safe and very, very effective. How long that effectiveness would last, that is something, we can't really say for sure at this time. Based on Moderna's release that I hear, they say for a year, it could be longer, could be shorter. But what we are seeing with the data that is there, that the antibody levels are still high after a couple of months once these were injected. So it looks like a positive sign, but we'll have to wait and see how long they'll last.
As we all heard, the governor is working towards a 12K vaccination day strategy, and that's what she's tasked the director of OHA. And based off of what we're hearing with respect to the logistical aspects of the vaccine rollout, is the main challenge is encountered with personnel available to administer the vaccine. We need licensed pharmacists. You need a certain license to administer vaccines on any level, and they're working to understand this entire process. From a person arriving to a vaccinated site to them leaving, and this causes a challenge because the people that have to administer the vaccine, they also have to care for their other patients that they're administering their regular medication towards, and so really it's a resource allocation type of challenge that we're attempting to model now. We're trying to gain some information about how many people are involved in this process. Can entities like Oregon State provide help with respect to aspects that are not medically oriented, such as data analysis, data input? We also have heard the challenges revolving around observation periods that have been established within this process. After someone gets a vaccine, they are observed for 50 minutes at the on-site to be observed by either the technician or the pharmacist to see if there's any immediate reactions to the vaccine or adverse reactions to the vaccine. If that happens, then I believe that observation window extends. And so this also puts a bottleneck in the throughput and the processing time that we're seeing.
It definitely prevents you catching the virus, or it takes a deadly form. Whether the transmission also stops, and the people who are do not show any symptoms, but they can still transmit the virus, whether that stops, that's still, more and more data is coming on that, and more clarity would come up in a couple of months. What we know for sure is that the vaccine, though, is preventing, a severe form of, you catching the COVID, or is resisting you getting, having any sort of symptoms of COVID related issues. So it's basically a preventative method, and it's working there. Whether certain population is also then decreasing the transmission, that's something I think is still under investigation.